funding for education is to develop and disseminate model training programs. Not a model train, model training programs.
So then I can start training models in my business. That's awesome.
See, there you go.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims from HIPAA for MSPs, and joining me as always is my co-host Donna Grindle of Card and Compliance. Hey, Donna, what's up?
Hey, David. I don't know if I'm as up as you. Did you get that coffee we were just talking about? Is that what it is?
No, not yet. It's one of those, try to force yourself to wake up live, flailing my hands in the air. See, the video's not on today, so I can flail around. Nobody will see it.
See, that's why we need you to do that in the video so that it's real.
It's just animated. I don't know that people want to see what I'm doing, spinning around in my chair.
Yeah, I mean, I don't sit still, or I can't anyway. I'm always in. So I did that, but you flailing your arms around would have made it such a better video.
Well, maybe next time.
Yeah. So for those of you who weren't able, since we we promoted it 12 hours in advance because we didn't know we were going to do it live.
Yeah.
But we adapted well to the fact that I had been sick and we hadn't been able to record and I couldn't speak, and so
yeah.
Thanks for adapting well, and those of you who joined us live and threw out questions to us and all of that. We think it went well, and we're going to actually try to promote one so you can watch for us to have a live episode, and and we can take live questions and all of that kind of stuff. So it's kind of cool. And for those of you who don't want to be heard, it is through the chat.
Yeah. But we can bring you in and let you talk.
If you want to come in, we can bring you in. So, but we're looking at potentially doing that from time to time, although, that means I've got to not wear my pajamas and not be Harvey hungover looking and those kind of things. And the dog. I saw Chance walk by when I watched the video.
Yeah, I did too. I saw it when it was going on. I was laughing.
Yeah, he's hanging out with me all the time. But I thought it went really well, and we did things on the fly and put me on the spot, and that went pretty well. So check it out. It just went online, so it made us late with last week's episode since it was live and not Memorex.
That is true.
But the video is embedded on the page as well as the normal podcast and all the notes. So there you have it. And we will do our best to promote it in advance so that you can plan to be with us at on a Friday.
Absolutely. We can make it happen. So that brings us, speaking of Friday, being not today.
Yeah, really.
Today we're going to talk about the future.
The future.
We're going to talk about the future. Yeah. So there's this thing called the 21st Century Cures Act, which every time you said it to me, I thought you were saying the CARES Act, so I couldn't find it. The 21st Century Cures Act, which is currently awaiting a signature from President Obama.
Yeah, but the White House has already said he's going to sign it, so they're just getting all the right people to be in the room, and the 42 pens they have to pass out with every letter, and that kind of stuff.
Yeah. Sure, it's hard to find a pen when you're having to pack all your stuff up to get out.
Where did I put those signing pens, Michelle? I told you not to pack up my stuff. Yeah. I wanted to use that carding pen. We'll send a Cardin one and a Carolina computer one. We'll send them one of each.
There you go. Maybe we need to get some for Help Me with HIPAA If you want to help me with HIPAA
yeah.
pen, let us know. We may get some done.
Yeah. Well, maybe we'll come up with some help me with HIPAA swag for people who send in questions. How about that?
Hey, that's a great idea.
Mhm.
That's a great idea.
Swag.
So, yep. So make sure you do that
Anyway.
while Donna's got a clean credit card we can use.
No, it always comes back to me. I don't know if you folks have noticed it, but it always comes back to me.
Yeah, well,
You have an idea.
So the 21st Century Cures Act, which among its other long list of provisions, lays out a number of privacy and security related projects for the Department of Health and Human Services, including finding organizations that intentionally block health data information sharing. Like people would actually do that. I'm sure they wouldn't. But some people are saying that the privacy and security provisions are kind of modest. However, it does have some funding in there. You like that word, funding? For HIPAA compliance training, which, as we know, could help address a lot of the problems and things that we talk about here on the show. So what are your thoughts on it, Donna?
On the Cures Act or the parts you've brought up so far? Where would you like this conversation to go, David?
Let's start with Title I, Innovation Projects and State Boxes.
I mean, this law is huge. Usually I like to get in there and I'll read them and be very, studious with it. But because it goes all over the place, it's really hard to do that. I mean, it hits on like the Joe Biden's cancer research moonshot, whatever he calls that program. It does some stuff in there. It does a ton of stuff with mental health and substance abuse funding and measures, so to speak. But it's a huge over a lot of different areas in the health world, healthcare industry bill. And this does refer back to the question that we reviewed last week about what do we think is going to happen next year. Mm-hmm. And, everybody's like, is anything going to change? Don't you think all of this will go away? And, our favorite thing is HIPAA's going away under the new administration. And we've battled that. It's not part of Obamacare forever. It's been around since 1996. I'm not sure what Obama was doing then, but he was not doing Obamacare. And so that's number one. Number two is if you read the news, any politician who's willing to stand up and say, we don't need to have cybersecurity standards and enforcement of them because businesses will just protect your data. You don't have to make them. They'll spend the money on that, even though it doesn't make money. No, they don't. They don't. Mm-hmm. It doesn't make a huge, big difference until it's already happened to them. And, fair market and all that kind of stuff. By the time it actually made most companies do things, as a standard rule of business, pretty much everybody would be, you'd have a whole new business of identity theft. So, and fraud and all of those things. So this bill and as much stuff as it touches on and the fact that they've worked on it for like 2 years and it is actually a bipartisan bill, I couldn't believe it. I mean, it easily passed Congress and it just flew through the House and the Senate once they made some of the final changes. And the final changes, we'll hit on that a little bit. It took out some controversial things about privacy, which would have been a huge change under the privacy and security concerns. But this bill is clear evidence that you're not going to see less enforcement because of what you mentioned with the changes for lack of sharing. We're going to start hitting you with it. So you're not going to see lack of enforcement of your obligation to protect privacy and security. At least I can't imagine based on everything that's in this law, and it's actually a bipartisan law. At least Congress isn't going to stop, but we don't know. Everything's so crazy. We don't know, but this is a clear indication that across the board, Congress is interested in getting things done that deal with this.
Mm-hmm.
So, that being said, what did they get done? And
Dun, dun, dun.
Well, the big thing that that
Need a news
we
ticker
watched
thing.
before, I know. Wish I could do a good Walter Cronkite, but not everybody would get that.
You're right.
So a big thing that they did was there was a lot of back and forth on the privacy rule and how it applies to research. And, I've mentioned before, you can get certified just on research privacy. I mean, it's a very complex situation to address based on, what you need to know about the patient to do proper research and how far out the data has to go to do proper research. So it's really tricky, and they were doing a lot of controversial changes on the amount you could share without authorization from the patient. So they really gutted that and said, look, we think that there is a great deal of value, and there is, to being able to share this information for obvious reasons from a medical standpoint. But from a privacy and security standpoint, you got a whole new ballgame. So now what they did is they authorized a committee to study it. I don't know. It's something that we think we need to do, but you can't figure it out. So there's a committee. And
Of course.
So yeah, there's a committee. That was a big thing that allowed them to really, get things done with it as far as the stuff we would pay attention to. I mean, there's some other things that were affected. There's a lot of stuff for FDA approvals and things that they can do to try to get drug trials through faster, because there's a lot of people that talk about, I go to another country to get drugs that help me because I can't get them here, which is ridiculous.
Look, Miami is not another country.
There you go. As I said before, you're just going to throw in crazy stuff every now and then.
According to Anton, I am not the funny one on the show. I ain't forgot that, Anton. I have not forgot that.
Yeah, he's managed a way to get a shout out in every episode now from you. So that's a smart move, dude.
Made me
Unless you don't want one. There are some funding cuts in there on some of the treatment programs and treatment and recovery for homeless folks, transition from homelessness, jail diversion programs. They cut all of those, which I don't, that's where they made the money. They're the most at-risk people, and I guess they're saying we give up. I don't know. But they cut the money out of that and used it for other things. And an important thing to note is this bill authorized the funding, but it still has to get approved every year in a budget. So that doesn't mean this will actually happen. That's all I'm saying. It's one of the budgeted items they're supposed to approve, but you know how that goes.
Yep.
There's a couple of cool things. All the places where they had to have a work group, they included on the list of people who should be on the work group to study things or figure things out. They included in all of those that there was an expert in data privacy and security, or specifically security experts. And, I, of course, did a scan and found, how many times did they mention security? Now, privacy is mentioned a ton because it was clear they were worried about privacy and stuff. So I wondered how much were they worried about security, and security is mentioned 188 times in the law. So, it's mentioned a lot in every case of how does this affect you. We always have to look at how it affects the privacy and security, which is great if it goes into practice. And they did another thing, which I think is a good thing, is under the ONC, the Office for the National Coordinator, who's really, that's the entity that is the National Coordinator for Health IT. And, they set the standards for EHRs and kind of drive the meaningful use stuff and all of that. And they had two different committees. They had a Health IT Policy Committee and a Health IT Standards Committee, which I didn't get it. So they merged them into the Health IT Advisory Committee, and they will be setting the standards for the priorities for different standards adoptions, including privacy and security of EHRs, which, these other two committees, that's one of the things they were doing. But I personally, in a lot of the meaningful use stuff, they have not been very strict and clear on the security requirements. And I think that's really only encouraged a continued lack of security.
Mm-hmm.
I don't know about you. Everybody's like, I just need meaningful use. I don't need HIPAA.
Right.
Can you do a meaningful use assessment? I don't want a HIPAA one.
I want the one where you get the money.
Yeah. And I don't want to pay you to do it. So I think that in the long term, because that'll be under one area and everybody is now more focused on privacy and security of everything, I think we're going to see that. I saw that there's a class action lawsuit that's happened towards a law firm who has not secured information adequately. So the lawsuit had a list of all these things that the law firm wasn't doing properly to secure things. And yeah, it was all the things you're supposed to do to secure things. And the lawsuit says they're not doing that to secure my data, and I want to sue them for it. They haven't had a breach. They just don't try to secure it. Now think about that for
interesting.
a minute.
Really interesting. So they are going after a law firm. Nothing's happened. There's been no breach. But just because they haven't protected the data, then they've got a case.
That's what they're doing. I mean, it's a civil action, I think, in Chicago. And I was just reading about it. And that's the part that I found most interesting is there are people that are doing these civil actions about breaches, and they're not necessarily getting a lot of big settlements through those because it's like, if you were at least trying to protect the data, they're going with it. But this is a preemptive strike. So it'll be interesting.
Wow. I guess, there's so many people out there that really don't do anything to try to protect your data that I can see where, that would be a concern. And of course, how people are with libel and trying to find ways to make money. It's like one of those things where I had a friend of mine told me years ago, they were like, yeah, if you ever have a bump up in a car accident, there's a certain amount of money that the insurance companies will just settle on. So, you can always get the small amount of money. And it's almost kind of the same thing. They know that they're not going to get a lot of money out of it, but they could probably go after about anybody and get some type of small settlement and just, nitpick the small settlements of death.
But yeah, I had a friend that used to do that insurance stuff, and they told me that if they offer you X to settle on the very first try, they're definitely willing to pay you way more than that to settle. And it's just how things work. It's how the money people work.
Okay, folks, there's your tip today on how to get more money.
Yeah, no, really. Work the system. But back to the Cures Act, not the CARES Act. No one cares, David. They cure.
Obama cares.
Oh, God. All right. So some other stuff in here beyond the research stuff. And I thought this one was huge is, and it goes back to our discussion that we don't see things changing or at least going away. This added in this bipartisan bill, imposing civil money penalties for organizations, and I think it clearly says in here somewhere it's vendors or providers that participate in intentional and inappropriate information blocking. So if they're preventing or discouraging access, exchange, or use of electronic health information that is, a permitted use, granted, but one that they should do, then it says that they can be investigated and be fined up to $1 million. And I can assure you there is so much of that going on. And I was just in a training class with some physicians this past weekend on Sunday. And one of them was talking about this particular provider. Anytime they try to get data from them, it's like pulling teeth. I can't get the records for my patients. And they were asking, what can we do? Because you're telling me there's no reason they should not have the patients. I have the authorization. Why is this such a problem? And I was like, well, you give them my card or we report them to HHS. That's what I'm saying. I'm just kidding. But we could clearly make this point going forward that this is in there. And it's definitely trying to make sure that we push interoperability. And that's something they've been clear about now for the last year, is we're not going to take this, that's proprietary. And a lot of the things in the bill that talked about sharing of information and standards and all of that, it said use standards that are set in the private sector, which that was one of the big things. And most people don't know about the healthcare industry tried to set transaction code set standards. So like electronic claims, when I started last century, in the 80s, when I was writing electronic claim software, every different insurance payer had their own structure of how it was supposed to be. And you had a different type of data that you sent to each one of them. So you'd have to pull out their data manual and track what you're sending in each one. And they came out with what they called the National Standard Format. And that was the insurance companies trying to work together, kind of like along the lines of the PCI stuff. But healthcare and how complicated healthcare is, what we ended up with in the National Standard Format was tons of space left available for as they decided. So each payer had places that they could put things. And there might be 6 places that you could put referring provider information, and all the payers looked at them differently. So the standards were not strict on purpose. There was a standard, but all it was here are the way the data is generally going to look, but how you use it, we can all do it differently. And that didn't go well. And that's why we switched to the ANSI, or the American National Standards Institute, I think is ANSI. And now we use the ANSI standards, which follow guidelines that you use any, like manufacturing and all of these other enterprises transmit orders and payments and inventory information and all those messages all the time. It's using those same kind of standards. So all of the standards they're wanting to develop in this bill, they're wanting to use. They don't want you to create from scratch. They want you to find something appropriate and use it. So we're going to be sticking with those private sector kind of types of standards that are already out there. At least that's, there's the HL7 and all of these others that we're using now, and they're going to, don't go out there and build a brand new one that belongs to your committee. And I can see people doing it. So that's a good thing that they made a point of saying that. And so it also then, it removes a lot of that's proprietary on the information blocking stuff. See, I brought it back around. Aren't you impressed?
I was wondering how he's going to do it.
So there's also a lot of stuff in here with a mental health focus. It's really trying to
that was for you.
Improve. Yeah, I know. Mental health, substance abuse, all that kind of treatment stuff. And there's always, they kind of have their own little subset of concerns on privacy for obvious reasons. And there's a lot of people that don't seek mental health because they worry about privacy and those kind of things. And then, of course, there are people that also do the, at least, you always hear about the celebrities going to treatment for whatever their latest quandary is that they need to get out of the way of the press. Sex addiction, whatever.
I think it's just a vacation.
Well, for some of them, they really need to be in there and stay longer than they do. But, that's another concern because people are actively trying to get this information. So they're really trying to open up some of the privacy concerns to help share the information. Like, you've got a mental health case, and a lot of it has to do with things like, the guy in Arizona that shot Gabby Gifford. They knew he had problems, but they were limited on who they could tell. And so we've got to correct some of that to be able to say, this is a serious issue and I need to be able to stop it, even if it may not seem like, because right now, if they don't make an imminent threat, you can't do anything about it. It's the same thing with the guy in Colorado that shot up the movie theater. So hopefully they can work some of that out. They're also setting up a study. It's another study, but this one is really, really, really important. And I don't know how you can do it, but if you do the matching of patients so that I have potentially like a national patient identifier, which, there's a lot of problems with having that. No one wants that. And we've also had, the Social Security number issue. That can't be it. Mm-hmm. But how do we match so that I know? Because believe it or not, there are other people named Donna Grindle. And
and poor things.
I know, really. One of them got into some legal mess one time. This attorney's calling me and telling me, well, you're an accountant. And I'm like, I can count, but that's all I can do. But being able to match our medical records so that you've got the right person and what criteria can we use to do that so you get the right treatment and the right decisions are made to be able to, my name and date of birth. That's really what we do it on now. So that's a
biometrics.
I know, really? Fingerprint? I don't know. Things start getting a little squirrely when you do that, though. That's the thing that, you start venturing now into privacy concerns. So there's a study. That's another study that's authorized. And we have, of course, to get the funding done, and then the study happens. And so, that process, we're looking at a long way out. But the big thing, and this is something that, we hear the people all the time, which is, it's kind of interesting that now everybody's like, well, why doesn't somebody give us some funding for this? Mostly it's the same people who want a tax cut, but I don't know where that's coming from. All right. But anyway, they want some funding to help implement HIPAA. Now, generally what they want is way more funding for some of the security stuff, but that's kind of hard to do. So what they have in this, and I've got to read it 2 or 3 more times to be sure, because they've got funding for training, and then they mention education in some other areas where they want to create education for providers on using health information exchanges, because those really aren't widely used, and they really want to push the use of that. They also want to have education to help educate patients on their rights to access of their medical records, which, heads up, if they create that, that's, people are asking us, we've talked about that before, people are asking us all the time, can I have this? They're telling me I can't. What am I supposed to do? So we get that a lot. So there's a lot of other things that are education, but this specific funding for education is to develop and disseminate model training programs. Not a model train, model training programs.
So then I can start training models in my business. That's awesome.
See, there you go. But some of the interesting way of the language, and this is the area where I have to go back and read it again closely, because it's regarding the permitted uses and disclosures consistent with the standards governing the privacy and security of PHI of patients seeking or undergoing mental or substance abuse disorder treatment.
Okay.
So does that mean the only training you're supposed to get is about mental or substance abuse disorder?
It kind of sounds that way.
Mm-hmm. So that I'm not quite sure about, but they're supposed to get expert opinion and all of this. They got $4 million for next fiscal year, $2 million for the next two, and $1 million for each of the next two. So a total of $10 million to do it over 4 years.
Okay.
So but the big question is, I've got to read that closely to see what is the training really supposed to do, because everybody's going to say, well, I'm not going to pay for training. I'll just wait till I can get the quote unquote free training. And you and I have been through enough evaluation of the 15-minute training videos with a test, and now I'm certified until next year.
Yeah.
Yeah. It's the cookie cutter stuff that just hits on here are the rules, everybody's good, and it doesn't train on your policies and procedures. That's also a piece of what are your policies and procedures. Because if I'm not showing somebody how to actually do the things I want them done, it becomes irrelevant that I have them.
Right.
So those were the big hits on the 21st Century Cures Act. They're out there. We don't, again, know how the funding and all of that will take place, but it is authorized. It does touch on a lot of things. And I think that it can, the sharing abuse penalty could be immediately implemented. So heads up, those of you.
Yep. Lots of things are changing.
The times they are a-changing.
Well, that just goes to show that this stuff is not going anywhere. It's going to get more complicated. And if they start putting out more information to the public about what their rights are and what they should be able to do and get access to, then that's going to create even more pressure on the hospitals and the practices to make sure that they are able to be able to accommodate that. So
yeah, they're supposed to understand.
Sends it all full circle.
If your patients understand it, you should probably understand it.
Yep.
That's the way it looks. So,
man,
there you go.
Well, that's a lot to chew on today, Donna. So I think we might want to cut it off right there.
It's a lot to chew on.
It's a lot to chew on.
Okay.
I'm sure we'll be talking more about this, and as it gets signed into law and we start learning a little bit more about the specifics and what they're actually going to do with it. I'm sure we'll be talking more about it in 2017.
Yeah, I think, there's a lot of other things that we're going to be talking about in our next episodes about what to expect in 2017, things you should be doing here at year end, that kind of stuff. So, like we said before, there's not a lot of changes that can happen in between now and the end of the first quarter anyway. It's all set. Unless they just say, stop doing everything. Which, I guess it's possible. Probable. I don't think so, but possible.
Yeah. Anything's possible, but not likely.
Yes.
Well, there you go. So that's our show for today. We thank you for listening. And if you would like to sponsor a podcast, let us know. Reach out to us via email, and we'll get back with you on that. And if you pass our rigorous training program, we might let you actually say something. You can also review us on iTunes. We appreciate those reviews. Share us out on social media. And you can visit us and leave a question right on our website at helpmewithhipaa.com. And we will be more than happy to address your question on air if it's something we can talk about on air. So just remember, folks, that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.